we go. Now we can get started. So good morning, everyone. My name is Ysidro Escobedo. I am the Associate Vice President of Civic Engagement and Advocacy at AltaMed Health Services. First and foremost, thank you all so much for joining us today. We are very, very excited to share with you the soft launch of our Ándale Quesperas campaign, also known as Come On, What Are You Waiting For? We look forward to partnering with each and every one of you. Before we get started, I wanted to go over just a few housekeeping items. First, we would love to know who's joining us today. So please do include your name, the name of your organization, and where you're joining us from in the chat so that we can all say hello to you all. Second, given our time together, we will probably be a bit limited, so that we ask that you make use of the Zoom Q&A function. If you have any questions, we'll be monitoring it throughout the presentation, and we'll try to get to all of your questions in a timely manner. Now let's get the show started. It is my distinguished honor and pleasure to introduce and share a little bit about our first speaker, who is my boss and AltaMed's president and CEO, Mr. Castelo de la Rocha. Mr. de la Rocha joined AltaMed Health Services, then La Clínica Familiar del Barrio, as executive director in 1977, and has since led its transformation from storefront clinic in East Los Angeles into one of the largest federally qualified health centers in the nation. As president and CEO of AltaMed, Mr. de la Rocha leads a team of more than 3,000 employees, and one of them, who oversees more than 400,000 patients and managed care members across AltaMed's network. Across AltaMed's network of medical, dental, and PACE sites throughout Los Angeles and Orange counties. He received his BA in political science from UC Santa Barbara, his JD from Berkeley Law, and currently serves on the board of the National Medical Fellowships and the Health Tech for Medicaid Expert Council. However, Mr. de la Rocha's commitment to civil rights predates his time at AltaMed, having played an important role in the expansion of the Chicano Studies program at his alma mater, UC Santa Barbara, and leading local Chicano movement efforts, a commitment stemming from his humble beginnings growing up in Chihuahua, Mexico. During a time of devastation for all of us and everyone in our community, getting us on the road to recovery and prosperity requires innovation and bold leadership. That's why I am proud to introduce our fearless leader, Mr. Castelo de la Rocha. I'll hand it off to you, Castelo.
Thank you very much for the wonderful introduction. You said, I appreciate it very much. To all of you who are joining us this morning, thank you for taking the time to learn a little bit about Andale Quesperas, our Andale Quesperas campaign. And for those of you who are already tied into our network, again, thank you for being here. And to the staff that has put this together, we have done this in very compressed periods of time. So thank you very much for the great work that you have done. As Lisette mentioned, AltaMed's roots have been in social justice since our founding as the East LA Barrio Free Clinic more than 50 years ago. Community health centers exist really basically to help reduce the burden of hospitals and keep people out of institutional care, whether it's acute care or skilled nursing, by providing primary health care services and providing those services where private care is not an option. But another component of community health centers like ours is to address symptoms of poor health outcomes with services like case management, transportation services, health education, and the like. We refer to this as addressing social determinants of health today, okay? Since our founding, AltaMed's mission has been to improve health equity in East Los Angeles, a long underserved Latino community. After 50 years of growth, we applied this end goal to all our populations across the service areas in Los Angeles and Orange counties. Equity and social justice has remained at the core of everything we do at AltaMed. To that end, our vision is rooted in one basic principle, that civic engagement is a catalyst for change and health equity. AltaMed launched this its formal civic engagement effort back in 2018. Since then, we have been building our foundation and infrastructure to reach deeply and effectively into the hardest to reach communities across California. The result, AltaMed has developed a valid, measurable, and replicable integrated civic engagement 5-touch model. Boy, that was a lot to say there. But the basic thrust of that is that we now have built a model network across the state of California with the infrastructure, people, resources, technology, platforms that are needed to mobilize communities across the state of California. The health and social injustice this pandemic has demonstrated is unparalleled and unjust. You are all familiar with the data, but let me just highlight one or two things. In California, Latinos have lost the most during this pandemic. As of last week, the mortality rate from COVID in Los Angeles County is nearly 3 times as high as the mortality rate for white residents in Los Angeles County. This is the highest of any ethnic group. We also know that areas with high poverty are more likely than any other group tied to ethnicity to die from this virus. It is our responsibility to step forward when others do not. Latinos make up 40% of California's population. I haven't seen the most recent census here, which apparently came out today, but 40% of Californian population is Latino. It would be irresponsible not to ensure that we are targeting them for vaccinations where they are and in the right language for the population. We are building our own community mobilization statewide network focused on health and social justice, which has the capacity to reach, activate, engage, and mobilize the communities we already know and serve. That scope can be significantly increased housing issues, transportation issues, and the like. It makes sense to reach communities in which we are a trusted provider. We are part of this civic engagement network. Adelante, ¿qué esperas? Ándale, perdón. I keep using adelante, but it's all the same here. Ándale, ¿qué esperas? It's a statewide COVID-19 vaccine outreach campaign intended to reach 4.45 million Latinos through public education and 2.25 million Latinos through direct community outreach in California. AltaMed launched the Andale Quesperas campaign in partnership. Great partners, San Ysidro Community Health Center in San Diego County, Clínica de la Raza in Oakland, the Latino Health Access in Orange County, Golden Valley Community Health Center in Central Valley, the My Community and My Health Coalition of Los Angeles County, and the Latino Coalition is a statewide partner, the Latino Coalition for a Healthy California. Our Andale Quesperas campaign will include merchandise distribution, information dissemination on the landing pages of adelantequesperas.com, social media, and digital contents and toolkits, a statewide call center, and an official hotline, 855 Ya Andale. What this pandemic has exposed and exposed to in our community is the lack of culture and linguistically competent education and outreach, as well as COVID testing and treatment that were not completely accessible at the front end of this pandemic. Local health agencies weren't able to respond rapidly because they did not have the local infrastructure to reach our communities most impacted by this pandemic, and did not make swift investments in local partners who could and did reach these communities, like the people who are sitting around and participating in this Zoom. As a result, the delayed response worsened the impact on the most marginalized populations, our community. Community health centers in the state serve over 7.2 million patients a year, primarily from communities that lack coordinated infrastructure of health, social services, and community resources. The California Office of Statewide Planning and Development 2019 annual utilization report says that 92% of community health center patients are racial minorities. 67% live at or below 200% of federally poverty level, and 34 would be best served in a language other than English. I believe that number is grossly understated. Nonetheless, this is what the State Department has on its files. In addition to community health centers serve as the health home to the uninsured, many of whom are undocumented, and in turn, community health centers and sort of look at community health centers as their sole healthcare providers, as well as areas where information can be shared with them. This is our lane. This is where our core business, this is where our experience is. And I certainly feel that we have a moral obligation to educate those who have yet to be reached. I am counting on all of us joining together to reach those populations that ought to be vaccinated. Thank you very much again for joining us today. And Lisette, thank you.
Thank you so much, Castelo, for those words and for sharing all this information. Again, community health centers are at the forefront of this work. And so with that, I now have the pleasure of introducing one of our very own trusted messengers and community champions, one of the most committed and devoted healthcare professionals that I know. No sé cuándo duerme, Dr. Shapiro. We are so thankful for his leadership. So with that, I want to introduce Dr. Ilan Shapiro, who serves as Medical Director of Health Education and Wellness at AltaMed Health Services. Take it away, Doc.
Thank you, Lisette. Familia, good morning, good evening, whenever you're seeing this. I'm actually going to take the mask for you. Today is a special day. And I can tell you for sure that even though the numbers are similar as last summer, 2020, and we know the results, if we continue the same pathway of the things that we're doing right now, we are going to end up having the same headaches. But I'm very happy to see everything that we are creating right now. And not only on the local level, we're going to the grassroots. We're going back to the familias. We're going to los abuelitos y abuelitas, to las mamás, to absolutely everybody that we have around us to make sure that they have the information. I'm deeply saddened when we see and we hear about resiliency. We need to go more and beyond resiliency right now. Resiliency is when they hit us, we fall back, and as the community has been happening right now, we have seen multiple times the same results. We were the first ones to have higher mortality rate. We still are. We were the last ones to actually get testing. We were the last ones to actually get vaccines. But familia, in our hands, we have the special empowerment. I'm back. We need to make sure that we actually using all the stuff that we have between all of us to make sure that we're creating the best things for our community. And I'm going to share a story that happened a couple of weeks back. We were calling a lot of family members. And part of it, we were making sure that they knew that they had the opportunity to get the vaccine. And we were calling, the high patients that we knew that they needed. And we spoke with the familia de Don Jose. We called Don Jose, and you know, the daughter answered, is Mr. Jose there? And she said, no. Okay, no worries. Can we leave a message? You know, when is he coming next week? You know, is he whatever? You know, we can wait. Like, he's not coming. Like, what do you mean that he's not coming? He died from COVID-19 1 week ago. Right now, all of us have the power to stop the spread in our community. Anybody right now that is suffering from COVID-19 that was unvaccinated and they are on the hospital and having all these horrible complications right now, that's a missed opportunity and preventable suffering. And right now, with the empowerment of all of you, that we all know qué necesitan nuestras familias. We know what they need to hear. And most importantly, it's not that we need to go and educate them. Hell no. They're fighting 1 or 2 jobs. They're going out there to make sure that they're bringing la chuleta to the table for their families. We're living day to day, not paycheck to paycheck, day to day. Right now, we need to bring the information, the opportunity to them to choose wisely and to understand what's the difference, because we already know what's about suffering. We know that what's happening to our community now, it's decades of problems with social determinants of health. And we have 2 choices. Choice 1, status quo, resiliency. We get hit, we go back. We hit, we go back. The second choice right now is to empower our communities and make sure that they understand something. And we go and ask them, Ándale, ¿Qué Esperas? And with that, Lisette, back to you.
Thank you so much, Doctor, and thank you for all your work. You all are at the front line of this work. And so as community activists, we are here to help and spread the message, but we thank you for all of your work. Now, I am going to share my screen here because we want to share with you this very exciting campaign. What does it all mean? What is it about? And so we're going to take you all just through a kind of a brief overview of this campaign. What can you do to partner? Again, you all know my name is Ysidro Escobedo. I'm the Associate VP of Civic Engagement and Advocacy at AltaMed Health Services. And so just to talk a little bit about our campaign, you heard a lot about who our partners are, what we're trying to do here. Our efforts are funded by the U.S. Health Resources and Services Administration. AltaMed, with this work, we hope to lead statewide efforts, and my apologies, having some glitches here, which never fails, right? Zoom glitches never fail. That's one thing. And so you heard Casulo talk a little bit about our goals, right? The 2.25 million, the 4.45 million in public education. But some of the other work that we are tasked to do is also to build the workforce for this effort. We want to make sure and train up and build capacity amongst promotores in our communities and make sure that even beyond the life of this campaign and effort, we have the workforce that is needed to continue to help our communities and lead us into the prosperity that I talked about a little bit earlier today. How do we do this? What is our campaign strategy? Our campaign is multi-layered, multi-tiered. One, we have our 5-touch model that I'm going to talk a little bit more about in just a bit. That we are kind of training and building capacity amongst our community health center partners. Casulo talked a little bit about who those are, right? In LA, in Orange County, in San Diego, Central Valley, Northern California. This is going to allow us to reach the entire state, right? I mentioned earlier about how AltaMed service areas include LA County and Orange County, but through these partners, we have a full reach of the state through this campaign. Our statewide coordinating agency, who's going to talk a little bit more about their role in just a bit, is the Latino Coalition for a Healthy California, that is providing the training and technical assistance for a lot of our subgrantees as part of this work. And then we have an external media campaign, which includes paid media, earned media, a lot of the creative, which we're really excited to share with you all today. It's really an exciting campaign. And then we have our statewide call center or hotline. What does that mean? That means that if you remember nothing else from this presentation, as you're walking out right into the supermercado or whatnot, and someone says like, no me vacunado, right? You can just say, 855 y Ándale, right? If you remember nothing else, the hotline will be routing all those calls to a place where someone can get a vaccine appointment. And so that is the purpose of our call center, that we can assist the entire state. How do we do that? And I know this looks like a lot. I'll explain it in just a bit, but everything is interconnected in our campaign. We have our sub-grantees in one area who are already doing amazing work around vaccine outreach and vaccine equity, but we are partnering with them to make sure that when we do those media buys, when we do those earned media efforts, when we send out those emails, when we do community work, that they're all being directed somewhere where folks can get a vaccine, right? We often come across a lot of TV commercials, right? That'll say, hey, get your vaccine. And you're like, great. And then it has a website. And then your abuelita says, great, pero I don't have a computer. I don't know how to use the internet, etc. Right? And so this is why the call center is very important, because all of these commercials and all of the ad buys and all of the news stories that we're doing are going to come with that hotline that we can direct into a service provider, one of the CHCs that I mentioned, or to an event, or to an appointment through My Turn for folks in California. Now, we are going to have some direct outreach effort. So in addition to kind of your vaccine efforts, right, which there's pop-up clinics, there's community outreach work that is just information around vaccines, we also are launching efforts, and our colleagues at Ysidro Health are going to talk a little bit more about that, into reaching communities where they're at, right? This doesn't mean that we're going to be just promoting at certain events or just doing the ad buys that we talked about. This also means that many of our partners are going to be making tons of phone calls. They're going to be sending texts. They're going to be in places where it's safe. They're going to be knocking on doors so that we get the community out and invite them to the vaccines and address any of their fears. We also have, of course, AltaMed will be linking to all of this, right, in Orange County and LA County. Additionally, we have our statewide partner support. So the Latino Coalition for Healthy California will not only kind of be making sure that all of our sub-grantees have what they need to do this work, but they will be providing creative assets to everyone, right? As community health centers, the challenge is often, you know, from small to large ones, the challenge is often making sure that we have kind of all these creative components, that we have posters on the go, that we have t-shirts on the go, that we have buttons on the go. The campaign infrastructure is going to provide all of that. The other thing that this is going to provide is that when we air, right, ads, and again, we're going to talk a little bit more about that, when we air ads across the various media markets, we're hoping that folks will see Andale Quesperas on their computer screens. They'll hear it on their radio. They'll go to an event, right? Or they'll go to the supermercado and someone from our organization will be wearing the t-shirt. And so regardless of where they're at in the state, that kind of echo chamber of the same message, we hope will drive our Latino community to get vaccinated. And so it really is it's something that we built a month and a half, but we have it down, I think, and it's really thanks to our amazing partners. I'm gonna not go into a whole lot of depth here because Castro really touched upon why this campaign is different. This campaign is different because it is a network of community health centers. And I did want to share that according to the Kaiser Family Foundation, and they release weekly data, right, on vaccinations, a share of first doses administered to people of color at health centers has grown from 34% in January to 77% at the end of May 21st. That means that we are playing a big role in this effort because we are in community, we understand community, and community trusts us. And so this is why bringing all of these health center networks into one campaign to reach Latinos is just such an important and critical part of this work. Very briefly, when we say our 5-touch model, what does that mean, right? Does it mean we talk to people 5 times? So AltaMed, with the partners who are part of this effort, back in through the census and through the 2018 and 2020 elections, launched My Vote, My Health, which one of the things that we tried to do is figure out how do we use the clinical setting and how do we use the community setting to get to everyone that we serve and the surrounding communities. We have a 5-touch model external, which is knocking on doors, calling folks, doing peer-to-peer texting, right, ads, earned media, and we have the 5-touch internal. What are all the touch points that someone that goes to our clinics goes through that we have access to talk to them, right? Maybe it's doctors having a button, right? This is Andale Quesperas to start a conversation. Maybe it's them watching some of the videos that we're going to show you today on loop in the lobby area, but it really is getting the message in front of our service areas in addition to the surrounding communities of our service areas. Lastly, I bet many of you are thinking, this is really awesome. I'm not any of those, the 5 organizations, but I want to do something, right? I want to partner with this campaign. I'm really excited about it, and we hope that we'll build the excitement throughout this presentation. What can I do? There's a couple of things. One, you can promote the hotline. Again, if you remember nothing else, remember 855 ya Ándale. You're talking to your tia and she says, no me vacunado, say 855 ya Ándale. Call right now. Let me see you dial it. Promote andalequesperas.com. That is live now. We're very excited for it. It looks really great. User social media kits, will be releasing these throughout. Post and share our content and your content around vaccine education using the hashtag Andale Quesperas or just hashtag Andale. We will be watching out for those and reposting. Host a partner event or partner with one of our partners, and we'll gladly connect you to all of them. Help us recruit community health workers and volunteers for this work. Distribute vaccine information in your community, and most importantly, monitor, report, and combat disinformation, which is a whole pandemic of its own. We have a lot of tools. If you go onto our website, there's actually links that show you how to monitor disinformation and how to report it, because we have to take a proactive role in that work. Any other questions? You want to request materials? You heard about the fact that we're having buttons and swag. You can email us at info@andalequesperas.com. I will reshare this contact information at the end as well. And so with that, I wanted to hand over my invisible mic to my colleague and partner in this work, who stays up with me till 2 in the morning as we're planning all these ideas. I wanted to introduce Cristina Sanchez, who is our Vice President of Public Affairs, who's going to be going over creative direction, paid media, and earned media for our campaign. So I'll hand it off to you, Chris. And you're muted.
There we go. Thank you, Lisa. Technology. I was actually unmuted already, but I'm extremely proud to be part of the AltaMed team and help guide the creative process and branding efforts on this important campaign. I think what Lisa didn't mention to you is that she's been with AltaMed 3 months and stepped into this and has done an amazing effort with the government relations team and of course under our fearless leader, Castro de la Rocha. As we prepare to roll out this incredibly important campaign, we wanted to share some of the insights and rationale behind our work. Next slide, please. I'll be covering some of the messaging, merchandising, digital strategy, earned media, and content production. Next slide, please. It starts with understanding our audience. And when we are speaking to Hispanics in California, we know it's quite an extensive and broad group of people. We have recently seen that California is the largest state of Hispanics, and we're in the heart of the largest community. Exciting news. Yesterday, Census just released its numbers, and for this first time, America's white population shrank, and with some of our cities showing incredible growth. And at the same time, we should be really asking ourselves, has the number of Spanish-speaking culturally competent doctors grown? Has Hispanic representation in the boardroom increased? Why do we continue to lead morbidity tables due to this incredibly devastating pandemic? Next slide. What you'll see on some of the images and some of the names, Andale Quesperas, it was born completely out of all of us sitting around basically saying, how do you communicate to your mother, your sister, tu ahijada, tu nina? And we basically said, Andale Quesperas, come on, what are you waiting for? We know that sometimes those messages, those words, those slogans resonate, very colloquial, very specific to our audiences. The color palettes that we used, warm, familiar, they speak to us, they bring us in. Next slide, please. The first thing we want to do is understand our audience. We come from both foreign-born and US-born roots. We need to find the balance of our overarching message and finding that universal appeal and issue. We understood that after months of vaccine messaging is everywhere, it's almost flooding us, and it's very confusing. We are now primarily dealing with those groups that are hesitant due to so much false information, and those groups that simply require a little bit of help in getting their vaccines. The images are warm and familiar, and they look like us, which is important. Next slide. As I mentioned, Andale Quesperas, very familiar, is our overarching message, which, by the way, we see as the rallying call for all of our areas and work moving forward. This campaign will live beyond the vaccination. It will be Andale Quesperas for everything else in education, civic participation, and so much that we have ahead of us. Next slide, please. One of the biggest insights that you saw was our trusted messengers, and we count with our own Dr. Shapiro, who has his own brand. Y no habló español cuando les estaba dando su mensaje, pero he has been, along with Dr. Veronica Contreras, the people at the forefront who are not only treating our patients, but know exactly the hesitancy and how to get those folks shots in the arm. So we thank people like him, and we'll be using them as well as our partners and many of their trusted messengers. Next slide. Here you're going to see a sample of some of the videos that are going to be playing, and I'll get a little bit later into social media and a couple of the paid and earned media strategies. So let's roll that video.
Hola, soy un doctor, pero también soy un padre, soy un hermano y soy un humano. En este último tiempo hemos tenido mucho miedo y se vale tener miedo. El miedo nos ha ayudado mucho para luchar contra leones, para sobrevivir, pero en este momento estamos teniendo miedo tóxico que realmente nos está atacando. Este es el momento realmente que necesitamos tomar una decisión. Yo me vacuné para proteger a mi familia y no traerle ese virus a la casa, para que pueda estar aquí para mi comunidad y sobre todo para ti. Por eso, ándale, ¿qué esperas?
I got vaccinated to protect my mother.
Getting vaccinated has never been easier.
And COVID-19 vaccines are free.
Yes, free and available throughout California, regardless of your immigration status.
Everyone over the age of 12,
like me,
is eligible to get the COVID-19 vaccine, and no insurance is required. Call to schedule an appointment near you today.
Ándale. Ándale.
Ándale.
Ándale.
Ándale. ¿Qué esperas?
¿Qué esperas?
That was an appetizer, un aperitivo, just a little taste of what it is that's going to come ahead. Social media. We know the consumption of our audiences is not just one vertical place. We are everywhere. We have our phones. That's where we're receiving information. We're in the bus, we're in our cars, we're listening to radio. Our social media is going to be very active, very live. We encourage all of you to please follow us. Please tag us, re-tag us, share, join us. Ándale, ¿qué esperas? The next slide, please. As we launch the campaign, you will see a style guide, a campaign toolkit, and we'll be doing lots of influencer events and activities, and we'll provide more information, or just go to our website for more information. As it relates to paid media, we have invested some money because we know it's not just about all of us corriendo la voz, but it deals also with paying on various digital platforms, and I'll go a little bit through that. This is going to be super geo-targeted. We talk about who we're trying to reach. Right now, those hard-to-reach communities are Hispanics, adults 18 to 34 in specific counties and zip codes. And the next slide will give us very, very specific zip codes that we're targeting. And we know that in, for example, Central California, we're going to consume media very differently. So we will be at the fair that's going to be happening there. In San Diego, we will be in radio where it's also being consumed. We're going to be in digital and several other places. So that message of Ándale Quesperas is resonating everywhere we go with our community that we're trying to reach. Next slide, please. Here's a little bit of a media mix. So, Andale, keep up with me here. We talked about digital streaming. Some of us go to Pandora, Spotify, Euphoria, which is the Univision platforms, and a lot of our streaming television. We know now that it's no longer just appointment television at 6 o'clock to watch news, for example, but on your time when you can do it. And many times you're going to get a lot of those ads. Radio will be doing a mix of Spanish language, some bilingual, believe it or not, but definitely a lot of radio as well. And out of home will be billboards and other touch points where these communities do, where we can reach them. And lastly, our trusted messengers. We saw that our doctors, our influencers, those who we have access to are the ones who are going to continue to give this message. And this is only the beginning of Andale Quesperas. And we really encourage all of you to join us, join this effort, as this will be a continued movement adelante, as Castro might say. And if you have any questions, please feel free to reach out to Lisette, myself, Berenice, the entire team, our partners throughout the state of California. It's been a pleasure to present to you. Lisette, back to you.
Thank you so much, Christina. I was about to start talking and realized I hadn't unmuted myself. And so thank you all for also bearing with us on this new technology landscape that we're all part of now, right? Where, you know, like this live, is it moving, is it not? So thank you. Now, I wanted to hand over the presentation to, as we mentioned earlier, this work would not be possible without partners, and it would not be possible without coordination, which we have been doing a lot in the past month. I mentioned to folks, sometimes I talk to some of our partners, to Cristina, more than I do my own family in some weeks, but it's really been quite a pleasure. And so I wanted to hand over the mic to Cecia Aquino, Dr. Cecia Aquino, who's a Deputy Director at the Latino Coalition for a Healthy California, to talk to us a little bit about the work that they'll be doing. And so with that, Cecia, I will stop my share and give you all sharing privileges.
Muy buenos días, and thank you for joining us today. My name is Cecia Aquino, Deputy Director at the Latino Coalition for a Healthy California. For over 29 years, LCHC has been serving as a statewide policy and advocacy organization solely focused on protecting and advancing Latinx health equity. Our work consists of community-centered programming, policy advocacy development, and strategic communications. Our work during the pandemic began in January 2020. We have worked directly with the Latino community across the state, including Latino leaders such as promotoras, grassroots organizations, and other CBOs. We partner on intentional and engaging campaigns such as our Plática series, where we connected community members directly to existing resources, a statewide listening tour to truly listen to what the community needed during this critical time. And more recently, we partnered with CDSS and CCF to advance our Pasa la Voz campaign, in which our promotoras led virtual conversations with community members to address any fears around the vaccine. This programming helped us develop the knowledge and expertise to now have the honor to step into this role as statewide coordinator for the campaign. In this role, we will support the training, coordination, and technical assistance of our powerful partners across the state. These amazing partners have been in the trenches doing the good work of saving lives, and they include the Latino Health Equity Initiative in Orange County, San Ysidro Health in San Diego County, Golden Valley Health Centers in Merced and Stanislaus counties, Clínica de la Raza in Alameda, Contra Costa, and Solano counties, and My Community, My Health Coalition in LA County. We will have the privilege to work together until the end of the year on this campaign. And you know, the power of this work is that this campaign is rooted in the power of collaboration, and it's a campaign that is led by Latinos and for Latinos. We understand the beauty and the power of our people, the grace and the understanding that we need to extend to our community when facing vaccine hesitancy, especially because our community is a dynamic one, often living in multi-generational and mixed status homes, and facing the realities of economic, political, and immigration challenges on a day-to-day basis. It is from this place of wisdom and understanding that we launched this life-saving campaign. Así que, ándale, ¿qué esperas? Back to you, Lizette.
Thank you so much, Cecia, and it's been such a pleasure to work with you and your team. And indeed, we've been hard at work and communicating constantly. And so now with that, I actually wanted to hand over the mic to one of those awesome partners that Cecia mentioned, which is the San Ysidro Health community health clinics. I will hand over the mic to my colleague, who we also talk quite a bit, right, in this coordination, Ana Melgoza, who is the Vice President of External Affairs at San Ysidro Health. So take us away, Ana.
Gracias, gracias. Buenos días. I'm going to go ahead and share my screen. And I want to actually start by saying that today is actually a very special day for us here at San Ysidro Health because it represents our anniversary day. We were founded 53 years ago by a group of 7 mothers looking for health care for their children along the border. And today's also, I would be remiss, Employee Appreciation Day for community health centers across the country as we celebrate National Health Center Week. So with that, I congratulate everyone on the AltaMed team and all of our sister clinics across the state, because really, especially throughout this pandemic, our place, our space has been vital, really for the lifeline of our community. So with that, I want to introduce you to some of our patients. These are actually patients of ours that have been to many of our vaccination events, as well as getting ready to go back to school. As in San Diego County, many of the school districts have already returned to class. So with that, we're very honored and thankful to be able to be a part of this transformative partnership. And I have to say, thank you to Coastulo and the entire team for thinking of us, because we really appreciate this innovative philosophy that AltaMed carries, and we appreciate this partnership quite a bit. So just a little bit about who we are in San Diego County. We started it, like, as I mentioned, 1969 by a Club de Madres that wanted care for their children. And who would have known that a group of very from humble beginnings would be able to create this network of care over 50 years later. We have 108,000 lives in our care. What's important really is our geography. Although we were founded down here along the border, throughout this pandemic, we've continued to expand. And now we actually have clinics in rural San Diego County, as well as up in North San Diego County as well. So we have 47 program sites and of those 26 clinics. For this campaign particularly, we're going to focus on 3 key areas. And it's been great to get data from the team already about vaccination rates in some of these areas. One thing I want to also let everyone know is, just because we've done very well with vaccination rates, for instance, down here where we're located along the border, we've been able to vaccinate about 90% of eligible people to receive their first dose, and are working very quickly to get that second dose as well. However, that doesn't mean that these areas have been as successful. And we also see that there's needs as well up north. So we're going to welcome this campaign to help us reach those areas as well. So the other thing I wanted to point out was just the intersection and how much this makes sense. Data did come out yesterday with regards to the census, and in almost all of these areas. In fact, the newspaper today reported that every single congressional district in the county saw an increase of Latinos 18 years and older. And that is a pretty big deal, because it shows that, especially because we're wanting to target that 18 and 34 demographic, we already know that the census is letting us know these are the areas to be focusing in. So what we're doing, and what we've started to do, are pop-up vaccination with care. What this is we know that throughout the pandemic, people have not gone into different spaces because they're afraid that they might get COVID. We also know many people have been working just to make ends meet in this double pandemic, economic and health crisis. So as we always do, and as many of our community health center partners do, we take the care out to people. So we provide COVID vaccination for 12-year-olds and up for hard to reach Latino families by offering vaccines in convenient locations. And hours. So we do a first dose and then we return 3 weeks later for the second dose. We've partnered with key allies such as Northgate Gonzalez Market. In fact, we have tomorrow a back to school event where we're doing children's immunizations, COVID vaccines, as well as other screenings. And Telemundo National just came last week to take footage of that. And we couldn't have asked for a better group of people because many of them were laborers that just didn't know where to go to get a vaccine. Many of them were people who held off because they couldn't take time off work to get the vaccine. And we also had children that were getting ready to go back to school and needed that vaccine to make sure they entered school safely. So this is really what this campaign is all about. Meet people where they are, and not just people, but meet our Latino families where they are. We are battling so many different challenges, from misinformation to lack of access. We're wanting to make sure with this campaign that we reconcile those barriers. So we're going to be increasing access to reliable information by having a bilingual provider or staff on site that can answer any questions with regards to the vaccine. We also will continue to reduce COVID infection rates because we also have that Delta variant. And so what we're wanting to do is make sure that people continue to practice those important infection control protocols at home, at work, at school. So we'll continue to pass out these PPE kits that include a thermometer, disinfectant, masks, and so forth. And then, as I mentioned, because we work with the chronically ill population, it doesn't matter. Someone may have already gotten the vaccine, but still we want to make sure that we're able to offer blood pressure screenings, glucose screenings, and in some areas, HIV testing as well. And more importantly, if we see something abnormal, to make sure we provide them to a medical home and a provider right away. I want to highlight our other two partners. Let me go ahead and talk a little bit about Southwestern College. They're going back to school and they're requiring everyone to be vaccinated. This is the largest community college system in the South County, and we couldn't ask for a better partner. They've been promoting already our vaccines, our clinics that we're going to have there on site. So we expect a large turnout. And then, as you all know, COVID really affected small businesses, the taquerias, the lavanderias, and so on. So we're partnering with the San Ysidro Chamber of Commerce and offering on-site vaccination clinics at their headquarters that everyone is familiar with, right across the border. So we're seeing a lot of activity there as well. This is just a snapshot of the calendar of our Vaccination with Care campaign, and you can see it's pretty busy. So this campaign is great because it'll allow us to amplify the work as well. And then that was external. Internal, I couldn't be more proud of our partnership because through AltaMed Civic Engagement, Mi Voto, Mi Salud, we made a big difference this last election, not only in increasing census response rates by 5% to a total of 73% response, especially in hard to reach areas, but we also increased our low propensity voter rate by almost 13%. And what happened with that is in the South County, in District 1, there's never been a woman to represent the district, and there's never been a Latino to represent the district. And as a result of this past election, we now have the very first Latina Board of Supervisor, Vice Chair Nora Vargas. And this all ties into political determinants of health in that Nora brings with her a huge, huge trove of health care policy because she was working for a community health center before she got elected to be the vice chair of the Board of Supervisor. So again, success built upon success. In the last campaign, we had buttons, we had QR code badges, and in return, we trained our staff to be able to talk to our patients about the importance of voting and completing the census. An example is Dr. Rodriguez speaking to one of his patients there about registering to vote. And I believe in this visit, he actually helped the patient register to vote. And that's exactly what our dedicated 2,300 staff is about. They believe in the mission of community health centers being that launch pad to really help people live the best life to their fullest. So we'll have training, messaging, scripting for providers and staff. We'll have those great commercials that were established on our closed caption television monitors in our waiting rooms. We'll also have phone banking with calls to patients. Just the other day, I was in a clinic and I asked one of the ladies that patients had just got vaccinated, what motivated her to come in. And she said, I haven't been out of my house. I don't want to be out of my house, but my doctor called me and said, I can't go to sleep knowing that you haven't been vaccinated. I need you in here now. And she said, that's all it took. And that's the same with voting. When we asked people how come they hadn't voted in the past, they said, because no one ever asked me to. So as our founding mother says, por alguien o por un lugar tenemos que empezar. We have to start somewhere. And so with all this collateral, especially the social media campaign, our goal really is to get activated. Again, we have a Delta variant. The communities where we live and operate were impacted 40 times more than the rest. And if you look at the amount of deaths, more than half are represented by our community and families in our community. So, Andale Quesperas, we're ready to hit the ground running. Thank you.
Thank you so much, Ana. We are so excited to work with you and all of our partners throughout the state. We wanted everyone to kind of get a little flavor of the Andale Quesperas San Diego, right? And as you all heard from Cecia, we're going to have this throughout the state, including our AltaMed service areas. So at this point in time, I want to thank everyone for joining us today. We look forward to partnering in this daunting endeavor with each and every one of you. We know that we always say la unión hace la fuerza, right? Coming together is how we're most powerful for the sake of our communities. Now let's go get the work done. Ándale, que esperan. Thank you, everyone.